Reflecting as a third-year medical student by Hameeda Y M Akoojee, Obstetrics and Neonatology Part 2. This video will focus on the past week's clinical rotation, specifically how the experience aligned with my expectations. This week's experience as a medical doctor in training compared to what I anticipated. In this section, I will compare the experience to my expectations, as was mentioned in Part 1 of my reflection. Theory to practice. Being on the ground has proven to be much more rewarding than I ever hoped it could be. I have numerous times been able to witness the practical implementation of theory I have learned in class. I observed multiple deliveries in which the partogram was utilized and sometimes even a CTG performed, and then, according to the information attained from these, interventions were taken to accommodate for what was discovered. Observing medicine being performed allowed me to transition between conventional class and practical doctoring. I wish to become, in the next few weeks, much better at interpreting basic tests in order to intervene appropriately. However, at times what was done in the hospital differed from the theory I learned, but clearly because of resource constraints. I witnessed this in the labor ward when women who seemed to give birth without complications were made to sit on chairs not even 10 minutes after delivery and were followed up after about 1.5 hours post-delivery, only because the labor ward was extremely busy and there was a shortage of beds. I was perturbed by this discovery, as I believe that the birthing process, as traumatic as it is for the child, is even more so for the mother. I wish to do my utmost for these women by ensuring that those in my care are made comfortable and are administered adequate pain relief. Skills. I learned many skills, those I wish to learn such as blood drawing, the administration of the intramuscular injection, etc., as well as many other skills that are essential in the treatment of a patient and at times a pregnant woman. Simple tests like the urine dipstick and its analysis, syphilis screening, rhesus testing, HIV screening, as well as undertaking a uterine massage and practicing controlled cord traction, essentials in delivering the placenta and preventing postpartum hemorrhage. Postpartum hemorrhage being one of the leading causes of preventable maternal death. Skills I learned pertaining to the neonate include the observation of jaundice and its treatment, drawing blood from an infant, determining APGAR scores, resuscitating the neonate, and also thoroughly examining them. At times, I was asked to perform tasks that I did not know how to perform. I was made to deliver the placenta of a woman who was bleeding profusely and required resuscitation. I was unable to do so as I had no experience. The situation, however, did not afford me the time to be taught. I tried applying what I had been taught in class alone. However, I was unable to complete the task. The importance of practice and experience became evident to me in that moment. Therefore, I must take any opportunity I get to observe and then practice when in the clinical setting. My observations of other healthcare workers. I have observed nurses, midwives, speech therapists, and here and there, doctors of different specialities. Most of the time, I was left in the care of nurses. They take care of the patients almost entirely and are always willing to teach students and answer any questions they may have. I was shocked, however, to see that they do not work in teams. It seems as if each nurse looks after one patient, and even if they require assistance, they do not ask nor does anyone volunteer. This is the reason why I was made to deliver a placenta despite not having done so before. This lack of teamwork in crucial moments has left me worried. I believe working in a team and supporting one another will lead to a more productive and efficient environment in which many more can suffer less and receive the assistance they require promptly. I observed the midwives for a short while, whilst witnessing a cesarean section. I was surprised at how willing they were to teach us, despite being occupied with the neonates that had just been delivered in 2 separate theatres, one of the mothers having given birth to twins. The 2 of them explained what they were doing and engaged us during their stabilization and examination of the babies. I was impressed by their work and wished to learn more from them. I was amazed to find a speech therapist in the postnatal ward. Upon inquiry, I was told that speech therapists assist in the initiation of breastfeeding in infants who seem to have trouble suckling, these being preterm babies who have not yet fully developed this primitive reflex. The way in which my interactions with patients have influenced my perception of patient care and needs. I spent a day in the antenatal care clinic interacting with numerous women who were attending their routine checkups. I realized through my interactions with them that whatever us as healthcare professionals wish to do, it is imperative that we explain what it is and why we are performing it. Also, all those we provide a service to would like to know the results of the tests performed on them and be assured that everything is perfectly normal, that they and their baby are healthy. If an abnormality is detected, they would like to know what it is and what will be done about it. This is the least that our patients deserve to know. Not many healthcare workers truly speak to their patients. I have sometimes done this as well due to time constraints. Even during the birthing process, these women who are going through so much and who express the pain they feel are ignored, not given adequate pain medication, let alone reassurance. Some are shouted at, insulted, or even hit. This is not respectful care, something that they fully deserve. In postnatal wards, I witnessed many mothers feeding their babies in a manner that is inadequate to sustain their baby's healthy growth and development. Not one of us had the decency to assist them and guide them, me included. I do not know how to address these kinds of situations without making a mother feel embarrassed. I should research and try to come up with ways to address this problem in a friendlier manner. Through my interactions and observations of others, I believe that we as healthcare workers are not caring adequately for and paying enough attention to our patients. They deserve respectful care, to be courteously communicated with, their privacy paid attention to, their dignity valued, given adequate analgesia, being made comfortable, etc. Our patient care currently by no means matches their needs. I will definitely have to, slowly but surely, work on these aspects of care so that I, one day, become a doctor whose patients leave the healthcare facility happy and healthy. As they say, a journey of 1,000 miles begins with a single step. That's all for today, folks. The third and last video in this series, which will round up this OBS and neoclinical rotation, will be released in approximately 3 weeks. See you then!